This is where the story gets, well, really interesting and maybe a little disappointing. Okay, so let's look at the scorecard for the most common ingredients, and you'll see the reality is often pretty underwhelming. Melatonin, the undisputed star of the show, might only help you fall asleep about 7 minutes faster. L-theanine, it can improve the quality of your sleep, but it won't actually help you sleep longer. The evidence for magnesium is kind of murky unless you're actually deficient. And then there's ashwagandha. It shows small improvements, but it comes with some serious safety concerns we're going to talk about in a minute.
Let's just double-click on melatonin for a second, because it is the face of this whole industry. The promise is that it's a magic bullet for incredible sleep. But the reality? Well, a huge analysis of 19 different studies found it helps you fall asleep just 7 minutes faster. 7. Is that statistically significant? Sure. But is it life-changing? Probably not.
And as we move down the list to other popular ingredients, the scientific proof gets even weaker. Studies on valerian root are all over the map, with one major review concluding its effectiveness was, and I quote, not demonstrated. Chamomile might mean you wake up a little less, but it won't add any time to your total sleep. And GABA? Well, scientists aren't even sure it can get into your brain to do anything in the first place. If it can't cross that protective barrier, it's not going to do much for your sleep. So if the science is this shaky, what do the real sleep experts, the doctors on the front lines, actually think about all these products? Let's see what the pros have to say. This quote from Dr. Noah Siegel really gets to the core of it. He says the absolute best way to fall asleep is to do it naturally. His biggest worry is something called psychological dependence. That's when you basically convince yourself you cannot fall asleep without your nightly pill or gummy. It becomes a crutch. And Dr. Michael Granner from the University of Arizona puts it even more directly. He says, look, insomnia isn't just a bad night. It's a legitimate medical condition, and supplements, by their very definition, are not legally allowed to treat medical conditions. That really changes how you should think about this, doesn't it? So what do doctors recommend? It's something called cognitive behavioral therapy for insomnia, or CBTI. This is the gold standard, the #1 treatment. It's not a pill. It's basically a training program for your brain. You work with a therapist to identify and change the thoughts and behaviors that are wrecking your sleep, like that racing mind at 2 a.m. And here's the kicker. Studies show it's more effective than medication in the long run, with 0 side effects.